Today was an exciting day for us. We came in to perform a bilateral cataract surgery on Zoey, your little sea lion here. It was exciting for me because Zoey came from the Marine Mammal Center. She stranded on the beaches in California in 2012, and we rehabbed her and got her healthy again. During our exam, we noticed that she couldn't see very well, and with examination of her eyes, she had some cataracts that was blocking her vision. So because she had the cataracts, we couldn't release her, and so we put her up for adoption, and the Blank Park Zoo took her with the understanding that maybe in the future we would do surgery on her when she was trained.
The lens of the eye is how the eye focuses, and we think because of Zoey's history of being a rehabilitation animal that she had some sort of a nutritional deficiency that caused that lens, instead of being clear, to being solid and opaque, so she couldn't see through it. We committed to do this surgery with a team of experts, and that's why we brought in Dr. Sean Johnson from the Marine Mammal Center and Dr. James Bailey. He's an anesthesiologist, because anesthesia in these guys is very tricky. And then Dr. Kolitz has developed the technique to perform these surgeries in sea lions and seals and even whales.
About 10 years ago, when I started doing these, not much was known at that time about their physiology under anesthesia. But since that time, the over 110, 115 animals that I've done with 2 different anesthesiologists. Now James Bailey is our anesthesiologist. He totally understands their physiology. He understands what they're gonna do under anesthesia. The choices he makes are to minimize the risk and to have a successful recovery.
There's a significant amount of difficulties with anesthesia. What we're trying to do is improve the technique. And since we're doing better monitoring, better support, we're actually able to keep them anesthetized for a lot longer than we used to. So we've improved care so that we can do more complicated procedures.
The surgery itself was really great as far as very quick, got the cataracts out really very quickly and sutured her up with no complications really that occurred. What I don't know is if she has never seen what she will see when she wakes up, because the brain and the eye have to have a conversation, and a lot of circuitry has to happen during development. And we don't know the length of time that takes. She's 3 years old, and she's certainly still young. And so potentially she might still be in that stage of development. So when she starts learning to see again, the trainers are gonna have a challenge, but I think they'll be able to make her a better animal with what sight she's gonna have.